A review from class for Nursing Assessment Visual Systems, Chapter 21 in the Lewis textbook. Just a quick review on the anatomy. For light to reach the retina, it has to pass through some structures like the cornea, the aqueous humor, the lens, and the vitreous. All must remain clear for light to reach the retina and stimulate those photoreceptor cells. A transparent cornea is responsible for most of the light refraction necessary in order for you to have clear vision. The aqueous humor bathes and nourishes the lens and the cornea. If there's an excess production or decreased outflow of the aqueous humor, this can elevate the intraocular pressure. Normal is about 10 to 21 millimeters of mercury, and the elevated pressure could result in glaucoma. The lens is a biconvex structure. It's located behind the iris. The primary function is to bend light rays to fall onto the retina. The shape influences accommodation, which is a process that allows a person to focus on near objects like when they're reading. The transparent gel-like vitreous humor in the posterior chamber must also be clear for effective vision. The internal structures and function when we look at the retina, the photoreceptor cells have rods and cones. The rods stimulate in dim light. The cones are receptive to color and bright light. The fovea centralis provides the sharpest vision, and the macula surrounds the fovea. Refraction is the ability of the eye to bend light rays so that they fall on the retina. When light does not focus properly, it is called refractive error. Types of refractive errors are myopia, which is nearsightedness, and hyperopia, which is farsightedness. Astigmatism is caused by corneal unevenness resulting in visual distortion. Presbyopia is a loss of accommodation resulting in an inability to focus on near objects. It occurs as a normal process of aging, usually around age 40. We're going to go over a few nursing assessments, beginning with the Snellen Chart. When the Snellen Chart is used to check visual acuity, the patient should stand 20 feet away. When documenting visual acuity, the first number indicates the standard for normal vision of 20 feet, and the second number indicates the line that the patient is able to read when standing 20 feet from the Snellen Chart. OS is the abbreviation for the left eye, OD is the abbreviation for the right eye. And the Snellen does not require nursing judgment, and it is appropriate to delegate to an unlicensed assisted personnel who have been trained to perform it. The Jaeger Card is used to assess near vision problems and presbyopia in persons over 40 years of age. The card should be held 14 inches away from the eyes while the patient reads the words in various print sizes. To perform a confrontational visual field testing, the patient faces the examiner and covers one eye, then counts the number of fingers that the examiner brings into the visual field. The consensual pupil response is tested by shining a light into one pupil and observing for both pupils to constrict. Observe the corneal light reflex to evaluate for weakness or imbalance of the extraocular muscles. In a darkened room, you would ask the patient to look straight ahead while a pen light is shown directly on the cornea. The light reflection should be located in the center of both corneas as the patient faces the light source. Accommodation is defined as the ability of the lens to adjust to various distances. Intraocular pressure can be measured by the tonopen. Glaucoma is caused by an increase in intraocular pressure, which would be measured using this pen. Make sure the area is free of eyelashes and the patient does not squeeze their eyelids shut. Hold the patient's lids open gently to avoid any pressure. Now remember, normal intraocular pressure ranges from 10 to 21 millimeters of mercury. An ophthalmoscope is used here to look inside the back of the eye and look for the fundus. The fundus is the blood vessels, the choroid, the optic disc, and the retina. The choroid is a layer of blood vessels and connective tissue between the white of the eye and the retina. It's part of the uvea and supplies nutrients to the inner parts of the eye. Color vision testing is done with cards like you would see here, and these are called Ishihara plates. In the pattern, some of the dots will appear to form numbers or symbols. Achromatopsia is complete colorblindness, seeing only shades of gray. Deuteranopnia is difficulty telling the difference between red, purple, or green and purple. Protanopia is difficulty telling the difference between blue-green and red-green. And tritanopia is difficulty telling the difference between yellow-green and blue-green. Keratometry is a diagnostic instrument for measuring the curvature of the anterior surface of the cornea. It is used to assess the axis of astigmatism. Extraocular movements. You would instruct the patient to follow a moving object only with the eyes in testing for visual fields and extraocular movement. To assess eye movement, hold a finger or an object about 10 to 12 inches from the patient's nose. Ask the patient to follow only with their eyes and only the movement of the object or finger in the 6 cardinal positions of gaze. This test can indicate weakness or paralysis in the extraocular muscles and cranial nerves, trochlear nerve, and abducens nerves, cranial nerves 3, 4, and 6. The eye patch. A loss of stereoscopic vision created by an eye patch could impair a patient's ability to see in 3 dimensions and to judge distances, so it increases the risk for falls and injury. Then we're going to go over some of these assessment abnormalities, beginning with the hordeolum. This is also known as a stye, and this is a tender, painful red bump located at the base of an eyelash or under or inside the eyelid. A stye results from an acute infection of the oil glands of the eyelid or from an infected hair follicle at the base of an eyelash. The bacterium Staphylococcus aureus is responsible for 90 to 95% of cases of styes and is frequently found on the skin. In children, it mostly occurs due to bad eye or hand hygiene, eye rubbing, and in women, it may be due to sharing makeup. The eye may feel irritated and scratchy, and later symptoms can include swelling, discomfort during blinking, watering of their eye, and sensitivity to light. A common sign of a stye is a small yellowish spot at the center of the bump that develops as pus expands in the area. It usually heals on its own in about 1 to 2 weeks. Warm compresses applied for several minutes 2 to 3 times a day may help in draining the pus and relieving the pain. A stye should not be rubbed or squeezed. Topical ointments are usually ineffective, and rarely would a surgical incision and drainage be needed. Blepharitis is a common chronic bilateral inflammation of the lid margins. The lid margins and lashes become red with scales or crusts. Itching, burning, irritation, photophobia, and conjunctivitis may occur. Sometimes you'll hear this referred to as the Sandman, whenever there is crusty material left on the lashes. Thorough cleaning of the skin and scalp must be emphasized. This is known as anterior blepharitis. Treatment with antibiotics and cleansing of the lid margins with baby shampoo are indicated to prevent more serious eye infections. Ptosis. This is a drooping of the eyelid, and ptosis may result from a damage to the nerve that controls the muscles of the eyelid, problems with the muscle strength like in myasthenia gravis, or from swelling of the lid. Entropium is a condition that typically affects only the lower eyelid. It is when the lower eyelid turns inward so that eyelashes and skin rub against the eye surface, causing irritation and discomfort. Entropium occurs most often in older people, and it affects women more than men. Artificial tears and lubricating ointments can help relieve symptoms of entropium, but they may need surgery to correct it. Left untreated, it can cause damage to the cornea, which can then lead to vision loss. Ectropium is a condition in which the eyelid, typically the lower lid, turns out, leaving the inner eyelid surface exposed and prone to irritation. Corneal dryness and irritation could lead to corneal abrasions, corneal ulcers, eye infections, and the corneal ulcers can threaten vision. Ectropium occurs mainly in older people and affects men more often than women. In severe ectropium, the entire length of the eyelid is turned out. When ectropium is less severe, only one segment of the eyelid sags away from the eye. Artificial tears may relieve the dryness and keep the cornea lubricated. Surgery, though, might be done to tighten the muscles that hold the eyelid in place, and it may be performed as an outpatient surgery with local anesthesia. Conjunctivitis, bacterial versus viral. The conjunctiva is a thin, transparent membrane that lines and protects the whites of the eyes and the eyelids. Pink eye, conjunctivitis, is an inflammation or infection of the transparent membrane, the conjunctiva, that lines the eyelid and part of the eye. Conjunctivitis can be caused by a bacterial infection, a viral infection, or allergic reaction of the conjunctiva. Viral conjunctivitis is the most common form, but bacterial conjunctivitis is more serious. The inflammation causes small blood vessels in the conjunctiva to become more prominent, which is what causes the pink or the red cast to the whites of the eyes. A corneal abrasion is also known as a scratched eye. Dirt and sand can scratch the cornea, so the best thing to do is just flush it out. Gently rinse with clean water or sterile saline solution. The key is to teach do not rub the eye while rinsing it. Exophthalmos. This is an abnormal protrusion of the eye. It can be bilateral, like in Graves' disease, or unilateral, such as orbital tumor. The thyroid problems are a major cause of exophthalmos. Anoscoria. This is an unequal pupil. It is more common than people think, and about approximately 20% of the population have unequal pupils. The classic signs of cataracts include blurred vision and light sensitivity. The lens needs to be clear to help focus light in order to see clearly, and if the lens is cloudy from a cataract, the image the patient sees will be blurred, the colors faded, poor night vision, or glare from headlights or sunlight. The treatment is to remove the cloudy lens and replace with an artificial lens. Glaucoma is the second leading cause of blindness, sometimes called the silent thief of sight. And glaucoma can damage the vision so gradually that many do not even notice any loss of vision until the disease is at the advanced stage. The loss of peripheral vision is a sign of glaucoma, and it's also important to note whether a patient takes any beta-adrenergic blockers, because this classification of med is also used to treat glaucoma, which means there could be an increase in adverse effects. The most common type of glaucoma is primary open angle and has no noticeable signs or symptoms except gradual vision loss. Early diagnosis and treatment can minimize or prevent optic nerve damage and limit the glaucoma-related vision loss. Primary open-angle glaucoma signs and symptoms include that gradual loss of peripheral vision, usually in both eyes, tunnel vision in the advanced stages. The risk factor is increased age, family history, and diabetes. It can be difficult to diagnose primary open-angle glaucoma due to the fact that there is not one single test, sign, or symptom that is a clear indicator that someone has glaucoma. Instead, a series of tests and follow-ups are necessary to establish the baseline health assessment as well as look for changes over time. Acute angle closure glaucoma signs and symptoms include severe eye pain or reddening of the eye, nausea and vomiting that's accompanied with the severe eye pain, sudden onset of visual disturbances, often in low light, blurred vision, halos around the lights. Closed-angle glaucoma is relatively uncommon compared with a typical open-angle form. In open-angle glaucoma, the entrance into trabecular meshwork is unobstructed, though an abnormally deep within the meshwork leads to elevated intraocular pressure. In closed-angle glaucoma, the entrance to the trabecular meshwork becomes blocked by the iris, which assumes an abnormally forward position. The aqueous humor cannot gain access to the trabecular meshwork and drainage canals, causing the intraocular pressure to increase. Macular degeneration. The growth of new blood vessels or an abnormal accumulation of waste materials into the area of the central retinal vision that blurs the central vision. The cause is unknown. Most cases, though, are age-related, and this disease cannot be prevented or cured. Patients will experience a central field of vision is blurred or unclear in one or both eyes. They can complain of the blurred vision, distortion of straight lines, or dark spot, or intermittent blurring of central vision that worsens over time. They have a decreased ability to distinguish colors. Next, we're going to go over the diagnostic testing, starting with the Refractometer Exam. This involves measuring the visual acuity and asking the patient to choose lenses that are the sharpest. It is a painless test. The pupils are dilated using cycloplegic medications during the refractometry. Meds are used to paralyze the ciliary muscle in order to determine the true refractory error of the eye and any treatment if the patient has uveitis. The pupil dilation will last several hours and cause photophobia. Ultrasonography. This is to evaluate the eye melanoma, retinal tear, or detachment. Sound waves reflect off the structures inside the eye and convert into an image that can be viewed on a screen. This test is easy and painless. Fluorescein Angiography. This looks at the blood flow in the retina and the choroid. Retinal dye injection is used to determine if there is a proper circulation in the retinal vessels in the eye. When dye is injected in a vein, a rapid series of photographs are taken. Among other things, this test can detect problems such as blockages or tumors. Since fluorescein angiography involves injecting IV dye, then it's important to instruct the patient to report any signs of extravasation because the fluorescent is toxic to the tissue. Signs of extravasation include burning, pain, but you as a nurse should be checking that IV site frequently anyway. The Amsler Grid involves using a handheld card with grid lines. The patient fixates on the center dot and records any abnormalities of the grid lines. The test is used to identify any damage to the macula. Remember that the macula is the central part of the retina or the optic nerve, so damage could be caused by macular degeneration or any other eye diseases.